Hello, my name is Jessica Graff, and this is my Diversity in Vulnerable Populations assignment. So this presentation is going to be on working with the Native American population. Currently in my field placement, which is in Whatcom County, Washington, there are two surrounding Native American populations or tribes. The above is the Nooksack tribe, and that is actually a picture that is on their website. And the below is the Lumi Nation. Again, and the Nooksack tribe is above Whatcom County, or like kind of to the side, and then the Lumi Nation is below it. And just throughout the presentation, just as an overall theme, it's important to remember that when interacting with any culture that is not your own, but especially one that has been systematically oppressed, it's really important to remember that you are coming at them as the other. So before we get into engagement, it's also really important to know at least some of the history. And in the United States, we have a really bad reputation, or at least especially before the Welfare Act of 1978. We had a really big reputation that was terrible of basically taking Native American children away from their biological families and ripping them of their culture and placing them into like American families. And this obviously was really bad. And so in 1978, they came up with the Indian Child Welfare Act, and it was implemented to keep Native children from being separated from their families by child welfare and adoption agencies, and to investigate the extent to which current child welfare policies undermined tribal survival through the unwarranted removal of Indian children to non-Indian cultural settings. So it basically requires all necessary attempts to be made to prevent Native families from being broken up. So what the literature says, typically spirituality is woven into the fabric of most tribal worldviews, and spirit, mind, body, and environment or context are all holistically and seamlessly interconnected. Basically, it's really important to be mindful of the world perspective that you're coming in with. A Western perspective of mental health will not be beneficial in this setting, and it will more likely be harmful to the individual and their family. So from a professional, the professional for this presentation, her name is Jamie Jones, and she is a former CPS worker in Whatcom County, and she has previously worked with the Lumi Nation and the Nooksack tribe. She's also my current field placement supervisor. So when speaking with Jamie, she explained that social workers must engage in certain types of meetings in which an elder of the tribe is present who is the authority of the room. And this is a really cool way that at least Washington State has tried to be respectful of the Native American culture, and it basically ensures a voice for the tribe when engaging in child welfare. So assessment. So what the literature says is that there are many aspects of Native American cultures that are very different from Western culture that a social worker and a mental health counselor should be aware of, especially since differences in the value systems can lead to misdiagnoses and even harm clients. From a professional's perspective, assessing Native American populations requires knowledge of one's own cultural lens and the cultural lens of the particular tribe being considered. Make sure to do your own research and understand history and cultural implications, such as children being removed and stripped from their cultures, how mental health is understood, cultural factors that impact the community, and how it's been imposed by the dominant group, and also how it's impacted their suffering. So for an example, if a social worker is assessing a member of a particular tribe for mental health issues, it's important to understand that particular tribe's views on mental health. Because again, coming from a Western view is not going to be helpful. Intervention. So, what the literature says, another aspect of most Native American cultures is that is different from most of Western society is the importance of community. Many tribal public health professionals use strategies for community capacity building and community empowerment as they begin to take control of their own health services. This demonstrates some of the importance of building a sense of belonging to a Native American client's community. A mental health counselor or social worker should encourage this in a culturally sensitive way. And then what our professional says, Intervening with Native American tribes and populations should only occur when absolutely necessary. In the case of child welfare, we need to be aware of our role as a social worker. We are the face of the oppressor. We also need to be able to recognize that we may not be the best person to intervene. And then she also said, allow them to be the experts on their own situation. And what that means, we say that a lot throughout the social work degree and also just in mental health in general, is that it's not our job to assume that we know what they need, how they're feeling, what their perspective is. None of that. That's not our job. That is definitely out of our scope for anyone, really, but especially someone that's coming from a different culture than us. So it's really important to talk with them, communicate with the client and the people in their culture and surrounding their lives, and make sure that you're coming at it from their perspective and you're letting them lead you. You're just there as a support. So for an example, in the case of child welfare, if you have to intervene in a child welfare case, it's best to find a social worker that's part of that particular Native tribe, because we're not going to be the best person to intervene if you're not from that culture. However, if that option is not available, the intervening social worker absolutely must learn about the tribe's culture and involve the opinion of an authority figure from that tribe, such as an elder. Evaluation. So with the literature review, evaluating outcomes of an intervention can be difficult to access, as success to an intervention is subjective. Mature, psychologically healthy Native behavior in a number of tribes includes generosity, interdependence, valuing the good of the community over oneself, humility, and respectful reserve in front of strangers, which could be misconstrued as dependency, masochism, passivity, and withdrawn behavior and depression by non-Native therapists. So this means that if you come in to this situation looking at the outcome of an intervention through a Western lens, you're definitely going to miss the mark when evaluating members of a Native tribe. And that arguably could be detrimental and even unethical. So from a professional's perspective, if you can place a Native child with a Native family where they feel safe, it would be celebrated as a good outcome. Reunification with culturally appropriate tribal-run interventions would be the most successful outcomes. Are they still keeping their cultural identity? Can we keep them the most safe, the most successful, the most culturally responsible way? And again, the greatest goal when intervening is to respect and encourage the tribe's culture. Of course, it's important that the child is safe in the home if we're talking about child welfare. But historically, as we have mentioned, it's been the case that we are always stripping children of their Native culture, and it's really important that we keep that in mind because that severely contributes to the health of the child and their family. And that is it. Thank you so much.